My guest today is Dr. Wendy Oliver Pyatt. She is the founder and executive officer at Galen Hope, which is an eating disorder and mental health treatment center located right here in the beautiful Coral Gables, Florida. Thank you so much for joining us today, Wendy. And it's so much happening in our community, and you bring a voice to those that need the voice. And so thank you so much. And I want to hear all about we had Amy Boyers here, and
Yes.
so it was so nice to have Dr. Boyers with us in our last episode. So welcome, and let's roll.
Great. I'm so happy to be here, and I love what you're doing here. And of course, being able to get the message out to our community about mental health and eating disorders is really my passion point, and I appreciate this opportunity.
So thank you. Very interesting, your background. How did you go from a young girl in Nevada to 25 years down the road? Here we are in Miami. And, this is not your first rodeo opening up a treatment center with Dr. Boyers, but a highly regarded treatment center. So let's get into that, and the young girl living in Nevada, which is a beautiful, dry, arid location.
Yes, it's kind of hard to think about how the dots connected. It certainly wasn't anything that I foresaw or envisioned in my future growing up in Carson City, Nevada, growing up next to a cow field. I think some of the most formative things for me were the fact that my dad was a Holocaust survivor. So I was a child of a Holocaust survivor living in Carson City, Nevada.
That
So
seems like it's almost like an oxymoron. Like it doesn't, like, how does that happen, right?
my dad's we could talk for a long time just about my father's journey, right?
Episode 423.
Yeah, certainly. I think, well, one of the things that I think kind of captures a little bit about my childhood is that my friends were names like Julie Ann, Mary Ann, Shirley Ann, Deanna Sue, and then my name was Wendy Frida. So it was sort of like one of these things is not like the other type of situation. Being that in a small town in Nevada, certainly there were no Jewish families, nor were there any, obviously, not too many children of Holocaust survivors getting raised in that community. Now, it wasn't something that overpowered our family conversation. In fact, it really wasn't even in our conversations much at all. But the shadow of it was like ever present in my childhood, the darkness of it, and certainly my father's struggles around his own trauma through that process and the way it sort of developmentally really just kind of blocked his development psychologically. And the ways he adapted really were formidable, but also, had a pretty significant influence on the reality of our world within our little home within that community.
So you grew up with two brothers,
Yes.
and you're the youngest.
Yes.
So that's a very interesting. And then you had your own struggles too. And how did that color? And do you think it contributed? I mean, that's a whole other program, I know,
Mhm.
from the Holocaust point of
Mhm.
view, and being a child of that, a product of that environment.
Sure. Well, absolutely. I mean, I think when you're talking about any kind of mental health condition, whether it's, addiction, depression, trauma, or eating disorders, you're really talking about a biopsychosocial condition. So mental health or behavioral health conditions are complex, um, realities that certainly have a biological foundation, but also have a psychosocial foundation. So we can sort of look at my own, pathway from that formula of a biopsychosocial. And if you just look a lot at the biological background of my reality, is that I was the child of somebody who went through a tremendous trauma, like an unspeakable trauma. And we understand more about how trauma affects the brain and even epigenetics. So how my father's own background and experience of trauma influenced actually my brain. So there's Darwinian evolution, and now there's an understanding of epigenetics. So the way somebody experiences life and trauma can actually affect how my DNA as his offspring is experienced. So with trauma, there's a lot to be understood now about how reactions that an adult or a parent went through changed the way my brain was maybe set up, maybe to have more arousal, inflammatory responses. So things of that nature that influence my brain. And then certainly the psychosocial reality. In our society, there's a constant diet culture just bombarding individuals. So if you think about genetics loading the gun and environment pulling the trigger, the environment is really pulling the trigger 100% of the time now in our society. So if you have any disposition at all, when you equate that to diet culture, that can really be the formula for problems with food.
Did you just wake up one day and said, I know what I want to do the rest of my life when I grow up as a young girl in Carson City, Nevada, and go to Miami and open up a couple of centers? Like, how did that evolution happen for you? Because I think we all travel on a road, and we expect the road to be very linear. And there are so many digressions as we go along. So tell us a little bit about the journey from where you began and to this moment.
Thank you for asking and for being interested. I think it is the antithesis of any preconceived path as far as why I'm doing what I'm doing now. I think that as we go through life, if we're true to ourselves and things that are guiding us from a passion point, and being connected to our authentic self, even when we don't know what the pathway is, we can sort of manage that uncertainty in a way that we're being true to ourselves and what is really meant to be for us. And I think I'm lucky enough that I had enough passion within myself and connection to that I sort of followed that versus, a pathway. So I'll just say that sort of at the outset. But I planned on being a veterinarian for most of my life.
Those that don't speak.
Yes, I planned very, very, very firmly. That was my path for sure. And then once I got into college and I was taking pre-med classes and things of that nature. Well, I was initially told by my first advisor at University of Oregon that I should not try to get into medical school or vet school because I wouldn't be able to make it.
That's what my high school teacher told me too, and
Yeah.
I wanted to be a veterinarian like you.
Oh,
but
really?
But
Yeah.
mine were allergies that prevented, and probably his lack of support. But that's another story in itself. But
Yeah.
so again,
Yeah.
you took a path, and
Yeah.
it wasn't where you.
Yes. So I sort of switched over from wanting to be a veterinarian to I thought, oh, I'll be an OBGYN. That was my first kind of shift into, okay, I'll go to medical school and be a physician. And I really wanted to work with women along, all spectrums of what women deal with. And so OBGYN made so much sense for me. But what happened is in my third year of medical school, I was in medical school at Downstate and I worked in a public
Where's
hospital.
that?
It's in New York City, in Brooklyn. And that's a whole nother story. But I was working in my third year medical school rotation. I had the opportunity to work in Kings County Hospital. And I encountered my first patient with a psychotic break, a young male that had his first psychotic break with disorganized speech and behavior and paranoid thoughts and delusions and hallucinations, and just saw the ravages of that mental health crisis for the patient and then for his family. And I just had a very strong, protective instinct or empathic response. But that was coupled with an incredible fascination when I saw the impact of the care we were giving and the fact that this particular person, we provided psychiatric medication for him and his brain responded very well to the medication. And within a matter of a week or so, he went from being floridly psychotic to lucid to a point where he could sit here and engaged meaningfully in this conversation. And I was amazed by that and the power of that and the excitement of being able to help people heal from conditions where the brain wasn't working correctly, just really fascinated me. And as I continued on in medical school, I had to make the decision about, do I want to be an OBGYN or do I want to go into psychiatry? Because in medical school, you have to choose your career pathway prior to doing your residence, internship, and residency. And so one day I was sitting on my bed and I had a bunch of the journals from the OBGYN schools on my right side of my bed, and on my left side of my bed I had the American Journal of Psychiatry journals all piled up. They tend to give students a lot of free journals, so I had journals surrounding my bed. And I noticed in that moment that I felt that if I was reading the OBGYN books, it was because I should do that. If I was going to be an OBGYN, I should know the material that was contained in those journals and books. But my natural, like, gut instinct and what in my internal self really wanted was I was eager and interested in what the writing was that had to do with psychiatry. So it was really about being really true to what was in my internal motivation. Like, so it wasn't because I should know this information, it was because I eagerly wanted to read those articles. That made me realize I really want to be, this is really my natural place, is in psychiatry.
And then you went into psychiatry.
Right.
And then how did it become eating disorder specific? And you also treat mental health issues
Yes.
over at Galen Hope. So
Yes.
let's tie that together and how that has created, wonderful treatment centers in Nevada and in Florida. So I'll let you tell that part of the story.
Thank you.
Because I don't know that part of the story.
It's when I think about it, I'm like, well, how did that all happen? But I think that, so my initial love and passion was community psychiatry and dealing with severe mental illness, and that was sort of my strength, and I had a lot of training in that, and very extensive psychopharmacology training through my experience working at NYU and Bellevue and Manhattan Psychiatric Institute. I worked in forensics unit, I worked in maximum security prisons, you name it, I worked in.
So you've really been in a lot of different environments
Oh
to
my
see
gosh.
the different psychologies that are happening in each of these environments. That must be very fascinating.
It's really fascinating. It's been such a treasured life experience. I really cannot think, and I'm sure there are some treatment settings I haven't been in, but it's hard for me to think of a treatment setting in these 25 years that I haven't worked in, whether it's private sector, public sector, outpatient, inpatient, hospital, forensics. I've had that opportunity to work in so many settings. But what happened is I wrote a book back in the early 2000s. I was encouraged by some friends to write a book because of my sort of somewhat unique experience of having had a history of an eating disorder, but also being a psychiatrist, to sort of like blend those experiences together. And I sort of did have a vision of how to help prevent eating disorders and also to help people who struggled. So I was really motivated to prevent eating disorders when I wrote that book, because I have the experience of diet culture that affects all of us. So I wanted to sort of find a way to help prevent eating disorders. So I wrote my first book in the early 2000s, which was called Fed Up. And out of that, some people approached me, and they knew that I knew about eating disorders, and some people approached me and said, would you ever want to open an inpatient eating disorder program? And I said to myself, well, I really wouldn't want to do an inpatient program, but I would love to do a residential program. And I knew
What's the difference?
Yeah,
because that gets into like for our
Yes.
audience that is watching, like who might be struggling or know someone
Yes.
that has struggled. What are the differentials?
Yeah. So within an inpatient program, you're more like in a hospital, so it's more for an acute treatment to prevent medical deterioration or a psychiatric emergency. So it's a very important level of care, but it's a short-term level of care just to help prevent something really, really bad from happening. A residential program, along with a PHP, what we have at Galen Hope,
Which is a
partial hospitalization.
Mhm.
So when you take a residential PHP and IOP, those are your longer term kind of treatment modalities where you can really address, we were talking about the biopsychosocial or biopsychosocial spiritual aspects of these mental health conditions, where you can really dive deep and get into the underlying dynamics that are at play. You can address the psychosocial barriers that are interrupting health and peace of mind. You can address the psychiatric care. You can do family therapy. You can do a lot of exposure therapy, meaning doing things also in the community, which is something that I'm very wed to at Galen Hope. So in that very moment, when they said, do you want to do inpatient, my brain somehow or another knew, no, I really want to do this like other kind of program where I can really do the longer lengths of stay and really get into the underlying issues to heal people, fully heal. And that's what we're doing at Galen Hope, is taking people very far.
So maybe you can talk about just how this happens. Is it a couple of months? I mean, you yourself, when you were struggling, how did you know? Or there was no outlet, there was no resources for you to grab onto. I mean, this Galen Hope is a resource, and it is a way out of a situation,
Yes.
but you didn't have that.
Yes, and sometimes I try to explain to families and to patients, I say, oh my gosh, you can just white knuckle it through your life and be miserable for year after year after year, or you can make the commitment to treatment and come in and really devote yourself to your healing for, what, a month, 2 months, sometimes 3 months. There's multiple levels of care at Galen Hope where you have more and more, opportunities to be out in the world. So we really are the highest level of care in the least restrictive environment. But you can devote yourself to 6 or 8 weeks of treatment and just knock off like years and years and years of suffering and misery. So for me, no, that didn't exist. So
Were you young at that
I
time?
I was like in college when I started to like figure it out. I was super lucky though. My college roommate actually went to therapy and had a really good therapist, and her therapist recommended some self-help books to her. So I vicariously through my roommate got to read
Was
about
this,
it.
what was it, what's her name? Roth. Janine Roth?
Absolutely, it was Janine Roth, Breaking Free from Compulsive Eating.
Or the other one,
When
if you want to
Food is
eat,
Love.
it's open the refrigerator door,
Yeah.
take a chair,
Yep.
take a seat.
If you want to eat, pull up a chair. That was one of her later books. But I read Breaking Free from Compulsive Eating, and I literally had a highlighter and a pencil, and I was reading this whole thing, and I was really like doing my own work, to figure out my way I needed to, the way I needed to kind of structure my relationship with food. But I was really, really lucky because it wasn't, it was certainly the kind of eating disorder that consumed my mind. So I very much understand like what that feels like. I even have some diaries, or I should have brought you a couple of diary entries when I came today. But I understand the thinking process. But I was really lucky because I didn't have like co-occurring obsessive compulsive disorder or co-occurring trauma or co-occurring major depression. I more had, quote, just an eating disorder, which was still quite miserable for me. But many of the folks who end up needing more care may have some other complicating features, or, I was in Carson City, Nevada growing up, and then I was in I was in a high stress environment from a performance point of view, as like being a pre-med and the medical student. But I also happened to have a really good friend group, and I just didn't have a lot of the stressors that some of our folks that we treat have.
And it's very, I really believe that an eating disorder, there's no textbook on it, or mental illness. There's no textbook because everybody is so individualized and our brains are wired completely different. So I really think that if one believes that there's a problem, or if a family member or friend sees that there's a problem, there's a problem.
Yeah.
So we don't have to put a label on it, but the Galen Hope is there to assist.
Absolutely. And so one of the things that we've done at Galen Hope is we've created a pathway to help people with, if they have an eating disorder or disordered eating, or if they don't and they're struggling with a mental health problem of some sort. I mean, post-pandemic, we have just such a need for mental health care. The pandemic has taken a toll on people's psyche. The impact of social media has also been very negative, and the isolation, and just the fact that we have social influences that are bombarding us with a lot of negative messaging. It's really affected us. We have major political divide also in our country that's created a lot of stressors. So there's a lot going on right now societally that's influenced all of us. So Galen Hope is there for both eating disorders as well as mental health.
And also in psychiatry, you're the state medical director.
Oh yeah, that was many, many years ago.
It seems like all these are
long ago in a faraway place. No,
but not really, because it all brings us to this moment, and it brings you to really being able to be an access resource to your community. So all roads led to the moment of today, and in Coral Gables and in Nevada, and great stuff.
Well, in Nevada, as the state medical director, I had at that time, as early career, before I started my first treatment center, I worked in community mental health, so working with like people who didn't have access to resources with severe mental illnesses. That was one of my passion points, and also teaching about that. I ended up taking a position with the University of Nevada, Reno, that involved both a teaching position and also just a clinical position, and at the state of Nevada Division of Mental Health. And I ended up, one thing led to another, I ended up being the state medical director, which is where I started my first PACT program, which is something that's really influenced us at Galen Hope.
Tell us about PACT.
Oh my gosh, PACT is just such a wonderful modality of care. It came about from the idea of thinking about all the resources that are put into care in an inpatient setting. And some people got the brilliant idea of like, well, what if we took all these resources and instead worked on helping people in the community? Now, not everybody is served by living in the community. There was that push towards deinstitutionalization, which did have a lot of negative impact too. But on the positive side, the PACT programs really had to do with what was actually the Olmstead Act, which was a federal mandate to treat individuals with mental illness in the least restrictive environment. So they took this idea of like, let's take all these resources.
And what does PAC stand for?
Program for Assertive Community Treatment. We're going to take all these resources we're dumping into inpatient care, and we're going to provide intensive case management and a truly biopsychosocial model with a multidisciplinary team in the community. So we, instead of kind of forcing the patients to come to providers, which is sort of our little egotistical way of thinking it's the only way to make people better. Well, guess what? It's very beneficial for us to also go into the community with those who are struggling. So we as PACT team members would go into patients' home, or I would potentially maybe even take somebody grocery shopping to do my assessment of them, or we would have community events for our patients so we could create a little mini social environment. We had nurses that went into the home. We were doing a lot of work to make sure people had stable housing, which is very, very important in severe mental illness. Stable housing, medication adherence, and a sense of connection and community is really important. That's why one of our taglines at Galen Hope is belong. So it's belong, heal, grow, because belonging and being a part of a community is a very important part of mental health.
So part of PAC back in Nevada days is really part of the Galen Hope
Yes,
mission.
correct.
And how does a family get involved as a community? And what do you provide for them as resources and outreach?
Thank
She
you.
laughs because that's probably another program.
Oh, well, I just love that you ask about family. I just sort of think, where do I even begin to talk about the importance of family?
So
and
when
mental
talking
health
about
treatment?
family,
Yeah.
Bloodline, family being community,
Friends.
friends, a spiritual
Yes.
community
Yeah.
or religious
Yes.
community, whatever you believe in.
Yes.
So it's really a multi-prong
Yes.
connection community.
Yes. So I think one of the things that ends up happening in a lot of treatment settings is people just kind of go for the path of least resistance, which is sometimes just to like not really think about what's not in front of them. So they think about the patient themselves, and they're not really thinking about the family, the community, the home environment, the social expectations within their psychosocial reality, and that really needs to be fleshed out. Somebody could be going to school that's like really high pressure situation that doesn't work for them. Somebody might have a family member with an addiction or an eating disorder themselves, or not. They could have a really supportive family that just is like, needing support themselves and figuring out how to help the person. There's a lot of different kind of family or support structures out there. But at Galen Hope, we place a very high value on involvement with friends and family. So we actually, a part of our treatment is actually a family program. So we have a director of family programming. We invite people in for multi-family groups. We do individual family therapy. We do family coaching. We also have a wonderful program for men and siblings and brothers, which is a male loved one support program with Joe Kelly, who is one of the original thinkers. He was really a thought leader in the importance of bringing fathers into the care of individuals with eating disorders. Of course, it goes beyond just eating disorders and fathers. It's really about bringing the male loved ones in. Oftentimes, not always, there's this sort of natural kind of drift that is not always the case, so don't hate me, anybody, but there's oftentimes we'll see the mom get really, really involved, and the father doesn't recognize, I'm saying this in a general way, the father or the male loved one doesn't necessarily recognize how very important they are. So we have a special program for the men, male loved ones program.
Because I think the men think that the women in their lives are going to take care of the problem. And so they can take a back seat, but that's all part of the dynamics of being a family.
Right, and I think sometimes the male loved ones in the system don't understand how very important they are. Because
you are very, very important.
Male loved ones, you're very important.
Number one.
I call you vitamin D for the dads out there. Vitamin D. We need vitamin D. I think that the bringing in the fathers and the male loved ones, and also siblings are sometimes really overlooked. Siblings are very affected by one of their family members having a mental health struggle or an eating disorder. And siblings sometimes are just over here in la la land, and they're really scared and very stressed. And the energy of the family can be going on to the loved one with a mental health problem, but there's a sibling over here just trying to get by in their life too.
Are you also supporting the siblings?
Yes, I think that's very
because I
important.
think also then they start having their own set of issues, or maybe they feel discounted. I don't know. That's a whole.
There's so
other-
many dynamics that can happen.
So,
They
but
can-
what Galen Hope, you really treat the family
Oh,
as
yes.
well as the patient.
Yes, the family is a part of the milieu of the patient, so it's like you just can't separate it out and just treat a patient. It's a
Absolutely.
family system.
And let's go into the medical and psychiatric management that happens at Galen Hope.
Sure. Thank you for asking about that. So we were talking about a biopsychosocial model for care and what that requires, since these conditions are rooted in biological and psychosocial realities. We have to have multidisciplinary treatment, which includes psychiatric management, dietitian or nutrition therapy, psychotherapy, exposure therapy, just other psychosocial supports, all as a part of a truly grounded biopsychosocial model of care. So, of course, psychiatric management is very important. Whether the person has trauma and really, quote, just needs therapy, or they need EMDR, which is a special kind of trauma treatment.
What does that stand for?
Eye movement and depolarization.
Okay, so
Yeah.
it's a modality that
Yes.
helps in treatment.
Yes. So we are able to address the biological piece of the person's condition, and in some cases that does involve psychiatric management with medication, which can be really life-changing for our patients to actually. First of all, sometimes they have to have proper diagnosis. That can be one of the first problems that comes when we see a patient come in the door, that the proper diagnosis wasn't made, and or the proper medication protocol wasn't put forth.
That
So
seems like it's a biggie. I mean,
it's a hugie.
That's a hugie. They
Yeah.
went to maybe the wrong clinician with a diagnosis. It wasn't appropriate. It isn't working. The patient has gone backwards instead of forwards.
Mhm.
So that's a lot on your shoulders. And you seem like a very intense but yet calm, like steering the ship, the
Yeah.
patient being the
We-
ship.
Well, that's a really good point. I think that the most important decision, or one of the most important decisions when you're dealing with somebody with a mental health problem, is really the appropriate care and the appropriate level of care. There's so many people out there in the world struggling with mental health problems and eating disorders who are either not getting any treatment at all, or just going to outpatient treatment once or twice a week, and just really having a miserable experience and just struggling in a way that they can struggle less and really heal more quickly. So the psychiatric management is certainly a part of it, but being able to be in the right level of care, so if a person needs more help than just a couple of visits a week, we can hopefully bring them in, do some really meaningful work over this, what really is in the scheme of their life, a very short period of time. Of course, when you're giving up your day-to-day life to go to treatment, it feels like a monumental.
Going through it, I would
Yeah.
imagine it's monumental, because you have to deal with things and that you're just not having to deal with before this moment.
Right, and also you're giving up, you're making a commitment and you're making a sacrifice. You're putting other things on hold for the sake of your mental health, and that's hard to do. And people don't like to say that they need help. There's stigma around mental health, so people don't want to say, I need help, first of all, nor do they want to say, I need mental health. And this is especially problematic for males, by the way, who have more social pressure to just kind of be okay. And certainly men with eating disorders face a tremendous amount of their own self-stigma and societal stigma about being vulnerable or having what is sometimes seen as a female condition.
How many eating disorders are happening worldwide, or even in Florida? I mean, just give me some numbers.
God
And
only-
women and men. I mean,
I just have to say God only knows. I mean,
Yeah.
it's hard for me to, there's a lot of information about but the research itself may be somewhat flawed. What I will say is that the idea that eating disorders are female conditions is really misguided. Men are not exempt from the consequence of diet culture and the pressures to pursue a body size and shape that defies biological reality. Now, sometimes men face other types of pressure to be, there's something called bigorexia, and there's this pressure to be very muscular, to have a V shape, and So men can get involved in over-exercise or using hormones and things of that nature that can be really damaging to the whole entire body. But we used to think of eating disorders as a female condition, and that's one of like the most important, I think, take-home points is that it's not just women, it's not just anorexia. Binge eating disorder is actually more common than anorexia nervosa and bulimia nervosa combined, and 40% of individuals with binge eating disorder are men. So there's a whole world of people out there struggling that really deserve help, and I'm especially wanting to mention the men.
And if you're struggling or you know someone that's struggling, Galen Hope, which is located in Coral Gables, our lovely city down the street, is out to help for the community, for your loved ones, for yourself. They are located at 806 South Douglas Road in Coral Gables. Their phone number again is 866-445-2163, or you can reach and get more information at www.galenhope.com.
Thank you. I do want to mention that Chloe and Erica are amazing on the intake number if you need to call and just find out more and see if you think that for you or a loved one, if it's something that would be beneficial, they would be happy to be there and talk it through. Even if you're not sure, even if you think you need some kind of help but you're not sure what it is, we are always happy to direct you to other resources in the community.
And I think that's really important, that partnership, and they're going to get a live person that you just named on the other end of the phone. So it is like home, it is a family place, and they have your best heart in their hearts. So don't be afraid to reach out. That's part of getting healed and enjoying a full life, because this life is just, you only go around this place once. So make it the best you can. And I appreciate you, Dr. Wendy Oliver Pyatt and Dr. Amy Boyers, who are just givers of the community, who have a wealth of knowledge. Between them, they have 100 years of experience. Not really, but they're really
Close to it.
They're only 25 years old each. But thank you so much for being here with me today and for sharing you with us. And I want to thank you all for joining in today at the Community Voice. Until next time, I'm Fara Sachs. Take care of yourself.